We're up and going. We'd like to welcome everyone to our ZYTO Wellness webinar series. We're excited to be a participant with you today. We're excited to introduce to you the new ZYTO Wellness webinar series. This is something new that ZYTO has never done before. And so we've had a really great response from a lot of you in participating with us. We hope it's a meaningful experience. We hope to utilize this next hour as we learn and grow together. We have some great lineups for the rest of this year, and we're launching this obviously with a great presenter today, Dr. Jason Ameling, and he's put together a great presentation. Jason, thanks for joining us.
Well, thanks for having me
here. Yeah, thank you. We're really excited. This year, 2018, we have a lot of really great and exciting goals that we've set as a company, and we hope that you've got a feel from us of things that we're hoping to accomplish and how you can participate with us. ZYTO technology is incredibly powerful, and there's a lot of opportunity and growth that can happen when it's utilized appropriately, and we hope that these educational events, as we bring in people that are from our industry experts, can further enlighten us and help us understand opportunities that are there in the market. I want to start out and just kind of give a quick clarification that ZYTO is, like as I've mentioned, ZYTO is a very powerful tool. That being said, we are not a diagnostic. We don't treat, cure, or diagnose diseases. But that being said, there's a lot of opportunity and information that we can gather when ZYTO scans are run. And so what we're going to go through today is a great experience with Dr. Ameling. He has a great amount of experience. He's actually an instructor at Trinity University, which is, you're probably more familiar with it, so I won't give a lot of background on that, but he graduated, Dr. Ameling graduated from Logan University in Chesterfield, Missouri as a doctor of chiropractic with a Bachelor of Science in Human Biology. He's been a practicing chiropractor, physiotherapist, and acupuncturist since 2008. Dr. Ameling is not only skilled in chiropractic adjusting, but also total mind, body, and spiritual balancing. And that's something that ZYTO is actually really closely knit with as well. You've probably seen some of the new branding materials that ZYTO has been distributing, discussing our three lenses that we look through at wellness, which is functional, emotional, and energetic. And so those fall in line with what Dr. Ameling will talk about today. In practice, Dr. Ameling focuses on heart health, functional blood chemistry, pH balancing, and reduction of inflammatory processes. In 2017, Dr. Ameling became a board-certified doctor of naturopathy, which further expanded his knowledge of assessment and care protocols. He began teaching in 2011 for both public and private colleges and universities. He enjoys sharing his knowledge with students and patients alike, and obviously today we're super grateful that he's here with us. He regularly speaks at health conventions as well as public education classes. Dr. Ameling is the proud father of two amazing boys, which actually later on in the presentation he shares that with us, and he loves spending time with them, his wife, and friends alike. So without further ado, I'm going to turn the time over to Dr. Ameling for his presentation.
Excellent, excellent. So let me go ahead. I just want to thank you for sitting here and listening to me for the next hour. I hope that you find it very informative. And if you have any questions, feel free to jot them down in the text or the chat window. That way we can reach them and talk about them later. So what I'm going to do is I'm going to close out my webcam because you don't need to see me. Let's go ahead and start going through the lecture. So what you're here today is we're going to talk about heart health and cholesterol. Over the years, this has gotten a really bad name. Cholesterol has been the bad guy, and it's not necessarily the thing that we need to focus on at the moment. So what we're going to do is go through some signs, some patterns, and some perspectives so that you can further reach out and identify if somebody's having these heart things, what do you need to focus on? Oh, let me hit the... There we go. All right. I always like to start with this quote, "The two most important days of your life are the day you're born and the day you realize why." This is profound. This information is going to what drives you and motivates you to help other people. I know that when I found out that I was put here on this earth, it was really to help people. I've always been a helper. I've always been a caretaker. Even in church when I was growing up, they always looked at me to get things done. If something needed to be completed, they come to me and I would get it done. But later in life, what I found is that people are struggling. They're struggling today because they need this health information. And who better to give it to them than all of us? So, next slide. What it looks like, heart health in general. Over the last few decades, there's been many approaches towards heart health, and some of them have been probably making the whole condition worse. So, low-fat diets, no or limited salt intake, these things puts added stress on the heart. What they're doing is they were focusing on reducing cholesterol. And if you reduce cholesterol, that puts a stress on the brain and the muscle tissues and the nervous tissues. So you need healthy cholesterol to survive. All your body was doing was trying to protect you naturally. So also looking at the no or limited salt intake, your cells thrive on salt. Without salt, they will not contract. You cannot build ATP. So without that salt intake, you're putting added stress on the heart and it won't function or fire appropriately. Now, am I saying that, hey, we need to pull all restrictions of salt? No, that is not the case. But you don't need to go on a no salt intake. Also, controlling blood pressure. This is still critical. This is still something that is basically beneficial today as well as was in the past. So really what I want to talk about today is our proactive approach. We want to be preventative rather than reactive. We won't want to wait till the heart is already taxed, the heart is already breaking down, and they aren't functioning. We need to get to this before it becomes a major issue. So what does this look like? Cardiovascular disease. So as far as cardiovascular disease, this kind of covers a wide basis of problems, anything that's in relationship to the heart. We usually see this as a blockage or a breakdown of the vessels that supply the blood throughout the body. So just a little bit of anatomy behind there. You have a heart, you have the vessels, you have got arteries and veins, and they travel the blood and carry it throughout the body. This transport system carries oxygen, nutrients, anything that you need to build up in a section or take away the toxins goes through this system. So really the commonly things that people look at heart disease and they identify it with hypertension, hypotension, which just means that the blood pressure is dropping, arrhythmia, which means that there's a malfunction in how it beats. It's not a rhythmic lub-dub, lub-dub, lub-dub. There might skip a beat or things like that. Did you know anxiety or lack of focus can also be contributed to heart disease? And then cerebrovascular accidents. Most people know this as stroke. This is when you have a blood vessel in the brain that rips, tears, breaks, or bleeds out up in the brain. Again, the brain is a very sensitive structure, and if it goes hypoxic, you have very serious damage. And then, of course, the cardiovascular accident. If you think of this one, you're looking at a heart attack. You know, if the vascular change is such a drastic difference, they're not going to have oxygen go into that heart muscle. And the heart muscle is the only muscle in your whole body that beats from the time you are born to the time you are dead. This cannot go without oxygen. So if you cut off blood flow to the heart, those muscles start to die off. So again, that heart attack is also called a myocardial infarction. So if you ever hear that term, that's what they're in reference to. These are some of the physical warning signs. These are actually the very serious warning signs that we often look for. You'll hear it on the news, you'll see it on the TV. This is what they consider, this is a heart attack. You know, if you're having excessive pain in the chest that radiates up to the jaw and the neck and the arms, possibly out the shoulder or down the back, these signs are related to possible irritation to the heart, angina, pain in the chest. Chest pressure or squeezing sensation. I often talk about the difference of acid reflux versus having chest or heart pain. If they are clutching their chest, this one, and again, this is not a definitive way to diagnose. This is just giving you an idea of which direction, hey, we need to make sure that they're protected or they need to get to the hospital. But if they clutch their chest versus if they take their fist and put it underneath the rib cage and tuck it up, that's a identifying sign that, hey, this may be a acid reflux issue and not necessarily a heart issue. But again, they want to be checked out. You need to have them evaluated to make sure that there's not something more serious going on. Again, look for nausea, sweating, feeling faint, shortness of breath. I know that we were having a family picture, and my grandmother, of course, she was the only one that was sitting in the sunlight. I don't know how we managed to pull that off, but she was sitting in the direct sunlight. And again, this is a hot summer day. We're all trying to get pretty, make sure you're smiling, make sure you're looking forward, and we were spending too much time taking the picture. She got very overheated and started having chest pains, and she started getting nauseous. And immediately, to my mind, I'm like, oh shoot, this is her heart. She's having stress. So I actually jumped into my preventative mode, and I started rubbing her heart 9, which is actually on the pinky. Again, this is the emergency acupuncture point that helps to regulate that whole system. And if she's having excessive energy building up in that system, this helps to alleviate some of that stress. Again, when the ambulance arrived, they saw no issues, no signs. So again, she was either having stress or anxiety, feeling amped up from the sunlight hitting her, or she could have been having some heart issues, and we were able to help her with the acupuncture. So again, these signs, don't take them lightly. If someone's having this in front of you, make sure that they seek out help immediately. Yeah, and we just want to cover our bases and don't ignore things that are blatant in front of us. Here are some of the external signs that we can also look for as well. So cyanosis, which means that you got bluing of the skin or you're getting very, very pale. This will happen in the skin and the nails. Your nails should be like a bright pink. They should be very vascular. So you can tell if you're not getting enough blood flow to those nails, they won't appear very pink. Then the next sign would be clubbing. So look over to the picture over on the right. So this would be normal fingers. So you can see how if you put the two fingers together, you can see a space between the nail bed. Over here, you can see this angle. This angle is representation of clubbing. The finger change happens when you go very hypoxic, so you're not getting enough oxygen out to the tissue, and that growth will change the way that the finger represents. Next signs, we're looking for edema, of course, swelling. If your heart isn't strong enough to pull the blood back up to it, it's going to pool out in the tissue. So again, watch out for edema. Next is a facial sign. So this is a picture of most people would recognize. This is Bill Clinton. You can see that he's got a red bulbous nose. That very red tipped nose is an indicative sign that there may be some heart congestion or heart issues. We see this time and time again, so make sure that you're looking for some of these signs. There's one too many. There are a lot of signs that we can look for in the body, and traditional Chinese medicine did this great. They've got tongue diagnosis as well as facial diagnosis. Now again, this isn't a diagnostic test. I use this more for triangulation. Look to see, are they having issues with this spot on the face? Then I would go to some clinical findings and say, hey, it's matching. And that's how I would correlate that information. But again, it's not saying that, oh, you've got a spot on your face, that must mean you have this diagnosis. It's just giving you an idea of what location to start focusing on. You'll see redness, wrinkles, abrasions. You'll see pimples or acne breakout in certain spots, all related to the different organs that they've correlated this through traditional Chinese medicine. As well as in the tongue, they've outlaid the organs so you can identify if they're having issues there. Of course, we're focusing on heart. So if you look for the heart signs, look at the tip of the nose, boom, there's your heart. Now, looking at the tongue, tip of the tongue, that is your heart organ. And that meridian is very strong, and that's why it will be represented there, right in front. This is a good friend. He's a good friend of mine. This is Eric. and he has allowed me to use his images, but for the reason being, he's got some of the subtle signs for the heart. You can see that his tip has a very cleft in it. It's kind of broken down the middle. That is a split sign or a cleft sign for the nose. That is a heart. It's imbalanced, or it was imbalanced at some point. So again, looking at the face, you can identify some of all these conditions or areas that you may want to be looking for. So again, heart. If I'm looking up here and I see a lot of signs, I'd look for the large intestine. If I'm looking for like kidney signs, if it's very puffy down here, if it's very dark, that's actually liver signs that we would look for. So again, you can take that information and kind of bring it together and say, yeah, you've got all these things that keep pointing towards this system needs help. Again, we're not diagnosing, but we are, again, identifying which systems may need some benefit. If you're looking for more information on face reading, we actually look at Lillian Bridges. She has a book that relates it to Chinese medicine. So again, it breaks down some of these signs and explains them more. Now that we look at the ears, so again, these are more microsystems, look at that crease. So the crease down here, you can see that's actually known as a Frank's sign. It's a heart crease. Most medical doctors actually know this and are believing that this crease is an indicative sign that there may be a heart imbalance and that they need to double check and look at more of the internal numbers. But again, that's what we're looking for when we look at some of these signs. Next, we've got the tongue. Now, he doesn't have a very pointed or very red-tipped tongue, but you can see some of the petechiae. I know the picture didn't turn out great, but some of those little red dots is related to that heart. And if you knew anything about this gentleman, he wears his heart on the sleeve. He doesn't put himself out there except for in instances where he doesn't have to get emotionally invested, and therefore he's very protective of his heart, and that's where it shows up in his face as well. The next, looking at these dark veins under the tongue, there's a couple different signs for this. One, we kind of relate it to possible heavy metals in the system. We also see it as blood stagnation. The blood is very thick, and that's why it's showing up in these veins. And these signs will change as we start to address the foundations. As we start cleaning up the system and supporting those organs, these signs change. That's what I was amazed with when I started learning this information, was when I was looking at a face, I thought everybody's face was about the same. Didn't really change much. Yeah, they got older, they had some wrinkles, things like that. But I never truly understood how much your face would change. And then again, when you look at the different sides of the face, they give you information as well. So the left side and your right side aren't the same. They give us different information. So I found that fascinating. Here's the nails. So again, looking at these nails, you can see they look pretty healthy. There's a couple ridges here and there, but you can see that he has lunulas, so these moons, present on all fingers. Now there are some people, again, these are different philosophies, some people that say on the pinky, if the moon is present on the pinky, that is a family history of heart, or that someone in their family has had heart issues. So again, it's kind of predisposing them to possible things to look for. Now, TCM perspective. So this is traditional Chinese medicine. This is what they focus on. The emotion and the physical suffering is one and the same, as the body cannot tell the difference. So the story behind this, the thing that really hit home, was my grandfather outlived my grandmother. And the whole thing was he was healthy. He was exceptionally healthy. He played golf every day. He ate clean. He exercised. He was active. He had very good muscle. Everything. He was physically fit. There should have been nothing wrong with him. And 6 months after my grandmother passed, he was sitting there talking about her and saying how he had such a broken heart, and literally had a heart attack right then. So don't tell me that the emotions cannot dictate the physical, because I've seen it. I've seen it. I've witnessed it. I've had to deal with it. But we can use that to our benefit. and go the opposite direction. And if we can keep our emotions happy, healthy, lightful, full of joy, we can actually help support this system rather than focusing on the negative aspects. So the heart meridian is actually quite crucial. It controls all the organs. It houses your spirit and helps control the emotions that are presented. So again, a broken heart can weaken this energetical system just as easily as high blood pressure, physical. So again, you have to get the emotions under control. We are emotional beings and we respond to those emotions. They release chemicals in the body. The neurotransmitters that are released in the brain are different depending upon if you're depressed, if you're sad, if you're happy, if you're excited. All of those things. We've done studies and they've done thermography and they've looked at the body and shown that your energy sits differently depending upon the emotions that you're presenting. So again, I found that rather interesting as well. So emotionally, our hearts thrive on warmth, gentle joy, love, and a zest for life. I've actually seen imbalances in this channel where they they've just a lack of joy. They do not enjoy life, nothing about it. And then often these people will start fidgeting. They'll be anxious. They startle easily. I've also seen that they have laughter at inappropriate moments. So like if somebody falls down and they get hurt, this individual is laughing. They find it humorous. And it's not the fact that they're cynical or the fact that they are just a mean person. It's literally the imbalance in this channel of energy. And they may want to have that addressed. So what's it look on the inside? So we talked about all the physical signs on the outside of the body. What does this look like to us on the inside? This is a zoomed in close-up artist rendition of the inside of a blood vessel. So what you can see is these little red blood cells traveling around. They carry oxygen. They're going to bring that oxygen out to the tissue and then profusely and is spread throughout the body. All of these little yellow things is the representation of either cholesterol, LDLs, HDLs, triglycerides, and things like that. But what we see here is there's a buildup right through here, and it's cutting down the space of that blood vessel. This is the deposition of fat that people talk about. And this is why they say cholesterol got such a bad name, because our body's natural defense mechanism is to deposit cholesterol and make that smooth again. Red blood cells get sticky if they hit anything that's not a smooth endothelial lining of that blood vessel. So if it starts hitting damage in that blood vessel and it gets sticky, that's a potential of causing clots and thrombus, and we don't want an embolism to happen and then travel to a location and cut off blood flow. So your body's natural defense mechanism is start depositing fat. Well, the issue with this is fat's not the one that caused the damage to begin with. So again, our presence of preventative and focusing on how we're going to support the system so that this doesn't have to happen. So we don't have to deposit that cholesterol. So what causes these changes where we start having damage on the inside? Elevated blood pressure. Think about this. Too much pressure pushing through. That blood vessel tears or rips, and now your body tries to protect you. Next, we've got increased blood glucose. Think of this like little tiny sugar crystals tearing up the vessel as it's flowing through. This causes extra damage along the lining, and again, you're going to deposit the cholesterol. Now, next is the big bad guy, high levels of homocysteine. Homocysteine is a byproduct from protein breakdown. So if you're having excessive protein breakdown, you better bet you're going to have excessive homocysteine levels. Homocysteine does the same thing that the glucose was doing. It's tearing up the blood vessel lining. And again, your body trying to protect you, it's going to deposit that cholesterol in place so to keep it smooth. So again, your body's natural defense, protection. It wants to keep you protected at all times. So here's what happens when we start to deposit that fat. There's no blood vessels in there. There's no cellular structure in there to hold it up and take care of it. So this almost becomes a hypoxic place where you start to have inflammation take place. And inflammation starts to build. And then we have to have white blood cells come in and start tearing up the tissue. So again, this is what we're showing. This is a stable plaque. This has been there for years. It's low enzyme production. It's not being broken down. There's not a whole lot of aggravation in that tissue. And then here's where we start to get to more of the dangerous zones. So again, I look for markers like LP-PLA2. This is an enzyme where it's only present when it's breaking down the liposomal cells that are inside that blood vessel wall. So this is the only time that that enzyme is present. So again, we can look at the blood test and say, if that enzyme is elevating, we know that we've got inflammatory plaque going on. And we want to make sure that it doesn't stay there too long, because if it does, it will actually sequester itself, rip off, and now we've got a thrombus/embolism issue. And just to clarify the difference between a thrombus versus an embolism, a thrombus is a stationary clot that's attached, whereas an embolus is something that's broken loose and traveling through the body. So again, both things we do not want. Now, are the traditional risk factors enough? Here's some statistical data that I was able to pull. Heart disease is the top global cause of death, with 17.3 million deaths every year. And again, that fluctuates up and down, but that's been pretty current for at least the last 80 years in the United States. This is the leading cause of death. So this is telling you that over the last 80 years, everything that we've put in place to try to take care of heart health hasn't been cutting it. It's not going down. We are still number one. So cardiovascular disease causes 1 in every 3 U.S. deaths. 1 American dies from cardiovascular probably every 40 seconds. So this is nuts. I don't know about you, but these statistical data doesn't make me feel comfortable about my heart health. So I needed to take it into my own hands. So looking at the nutritional information, the nutritional facts, you've got a couple organizations that are fighting for us. They're literally trying to come up with the appropriate data to try to minimize this and reduce it. The problem is they keep doing studies and they keep finding out that their information just isn't cutting it. It's not saving as many lives as they want. So total cholesterol panel consists of HDL, LDLs, and triglycerides. This is what most people run. So if they go to the MD, they're going to run a blood panel and look at the lipids. They're going to run a cholesterol, overall cholesterol with HDL, LDL, and triglyceride breakdown. What they're finding is that 75% of every early MI patient, so early in life, myocardial infarction, that's a heart attack, they had normal lipid ranges. I don't know about you, but that's scary. That means they were within range and they still had a heart attack. So what we need to take from this is that the data that they're using to determine if you are safe and in a normal, healthy heart zone isn't cutting it. Now, looking at the American Heart Association, their statistics show that 41% of every recurrent cardiac event, lipid panels are still within normal limits. So we need to start looking at extra data. This is what's going to help protect us. Now, some of the health history patterns that we look for. So some clients will come in and they will tell you, hey, I've had a heart attack or I've had issues with my heart, and they give you that information right off the bat. This lets you know that, hey, we really need to support this person even more than just the standard Joe that walks in off the street. We also look for clients that have diabetes or have been diagnosed with hypertension, if they are overweight or obese, or even if they still smoke. Now, I know that smoking has gotten a bad rap over the last, I want to say 10 years. They've really been hitting the advertising hard, really been hitting the awareness so that people know that it's just not healthy for you. So it's been going down, but it's still, people smoke today way more than they need to be. And again, this puts them at added stress and added risk for heart issues later in life. Now, what we do in our office is I check for more than just the standard lipid panel. I want to run a complete metabolic panel, a CMP, that gives me a glucose, that gives me some of the bun, the liver, the kidney, all of those things that I can see from that just one inexpensive test. Then we've got the lipid panel with fractionation, which I'll talk about in just a minute. LP-PLA2, I did mention that. That's the enzyme that shows up when there's inflammatory plaque. Cardio-CRP, this is related to an overall inflammation of the body. This one's a very small number. Anything above 3, you know you've got inflammation in the body. Anything below, yeah, it means that you're doing pretty good. So here's the only issue with the cardio CRP. It doesn't tell me where the inflammation is. It just tells me that there's inflammation in the system. So if you run if you have someone run a CRP, it's going to tell you if there's inflammation, but it's not going to tell you exactly where. D3, it's been a buzz lately. D3 is very important and crucial in a lot of hormone functions as well as immune function, and then also helping to regulate cortisol, which is the big bugger that most people have an issue with. So D3 is very critical. And from what I see and from all the research that Lauren and I have done, my wife Lauren, most people are deficient. Most people are horribly, horribly deficient with D3, and they definitely could benefit from having some. It is a fat-soluble vitamin, so you don't want to go excess with it, but it is very, very beneficial. Now, omega-3 and omega-6 fatty acids, these are very important for the outside of every single cell of your body. The outside of your cells are made of fat, and without healthy fats, you won't have healthy cells. You'll actually beg, steal, and pull from other cellular debris to try to build up your cell wall, and it just doesn't cut it. So we have to have healthy fats in the system. And then, of course, checking for homocysteine, the big bad guy that we want to make sure isn't causing any unrude damage. So my key difference, I look for the ion fractionization. I want to know the exact size of these fat particles. The whole issue is everybody looks at, oh, HDL, that's the good guy. LDL, that's the bad guy. Well, they both have their benefits. The trouble is they come in different sizes. And if they come in different sizes, this is where we come into big, big problems. So looking at this picture, you can see that we've got very, very small all the way up to very, very large. Of course, the best option for you is the more large particles you have, the safer you are. So we're looking at this picture off to the side. This gives us a visual representation. Now, obviously, I'm not measuring and pulling all of your fat cells and putting them on a scale like that. They actually do it with a laser. It's pretty cool. But what this is showing you is that I can have the same amount of large. If I just measure where it comes to the weight, I can have 5 of these large particles versus a bunch of these small particles. This one puts us at higher risk. So this is almost double the amount of particle sizes that we have. So yeah, putting us more at risk. So if you have lots of extra little small LDLs floating around the system, this is where I've had a healthy 30-year-old have a heart attack. He was basically all the way over here, had so many of these small particles that he was within healthy normal range, except if you multiply it out, he was probably twice as high as he needed to be. So again, this gives us insight of what's going on. I often think of this like the rocks in a bucket. So if I have a bucket and I put in a bunch of large rocks and measure how high it comes in the bucket, again, versus how if I take small, tiny peat rocks and start measuring where that comes in the bucket, both are at 130 milligrams per deciliter, but one is much more at risk, the very small particles. So I just want to make that point. Here's what it looks like on a blood scan. This is what they're going to give you as a printout. So what we want, and of course this person is out of balance. So you can see how their small particles are higher on the graph versus their large particles are smaller. So we'd want to see this flipped. I'd want to see this higher and this side lower. And then I'd want to see this side lower with this peak being over here towards large. So again, the larger size particle, the safer this client is. Now, second difference between my practice and, say, a traditional MD, we're looking for sources of inflammation. So I use the blood biomarkers to allow so that we can easily identify and show this client, look, you have inflammation in the body. You have to address this, otherwise it can cause issues with many of your organs. So unless your doctor fully understands the importance of getting rid of systemic inflammation, they may be missing this information. They may be telling the client, oh, you're healthy. I can't tell you how many times I've had a client sit in front of me and say, well, my doctor says I'm healthy. I got good board of health. They said I'm healthy as a horse. And I pull out this information and I show them on the graph and I show them where they truly are, and it gives them room for improvement. So it gives them areas where they can address and work towards improving so that they're the healthiest they can be. So let's talk about healthy heart options. I wouldn't be doing a good job if I didn't tell you how to address it. So again, these suggestions are straight off the Heart Association, what your MTs are recommending. So if you look at everything on this list, everything is things that we can do. It's over the counter versus the one medication that's on here. So everything else we have access to. We can work on our heart healthy options by ourselves and kind of address this and have them being in almost a cheerleader form, backing us up, making sure that the medical is supporting our decisions for healthy lifestyle. I can't tell you how many times that we've had a client go to a medical doctor and say, I'd like to try a healthy lifestyle before I jump on the medication. And they will say, yeah, sure, go for it. Let's see it. But the whole thing is that the doctors get so jaded because so many people have tried and failed because they didn't have the support structure. We are that support structure. We are there to help support people and get them into their correct heart healthy options. So let's start breaking these down. No diet is good for everyone. There's not one single diet that will fit every single client that walks through your door. So the trouble is we need to figure out what's going to be their best option, what's going to be their best fit. You can often look at an AIP diet, an anti-inflammatory, a Mediterranean, paleo, even gluten-free sometimes. The trouble is that all of these can go too far in the opposite direction that we want. So for instance, if paleo, they may try to overdo it on certain meats. They may be eating way too much meat for what they want. They may not be eating enough vegetables or introducing some grains, too nuts, things like that. So it's all about balance, truly, is when I approach diet. And then, of course, the gluten-free. Some of the gluten-free items are still chemically processed, and you have to watch out for that. So again, I wouldn't recommend any specific diet, but focusing on reducing inflammation. We always talk about the foundations at Trinity. You've got to support well-rounded nutrition. They need a wide variety of vegetables and fruit. If it grew, if it ran, if it was living and breathing, it's good for you to eat. But we try to minimize as much process as possible. And then, of course, exercise. Exercise, there's a little bit of a warning with exercise. Start slowly. Do not introduce your clients to heavy amounts of exercise if they are not ready. Again, if you already know that they've got a taxed heart or their heart is imbalanced, you don't want to stress that heart too much right off the bat, because that will put them into heart stress and possibly the sensations that we talked about at the beginning of this lecture to really watch out for. So again, the different types of exercise that I like to introduce: interval training, strength training, stretching, even water aerobics. My mother-in-law does really good with water aerobics. It's easier on her joints. She was complaining about her knees, not wanting to do heavy amounts of lifting, things like that. But I introduced her to water aerobics and then transitioned her into doing Tai Chi as well. So she gets the gravity exercise as well as the reduced gravity exercise through the pool. So again, you've got to find what's going to fit best for your client. I always talk about find something that's fun. Find something that interests you, because if it's a work or chore, you're going to really stress them, and it's going to be an added stressor rather than an added benefit. So body movement is crucial. You got to get them up and moving. But what this also helps is helping to pump the blood. Your veins do not push the blood back towards the heart. They're reliant solely on the muscles surrounding them to help move that back. If you look at today's society, how much are we just sitting there and lethargic and not moving. Even if you look at our jobs these days, we're sitting in front of a computer, we're not up moving around, we are not walking around all day long. If you look at the, say, 200 years ago, what did you do all day long? You worked outside, you were up, you were moving, you were gathering, you were chopping, you were working on your farm, but basically all of that kept you moving and kept your heart moving and kept your blood moving through the system. Now what we're doing is we're sitting there lethargic and relying solely on our hearts to pull it back, and it's just not cutting it. Next would be niacin. Now I'm going to give you a little warning with niacin. Not a whole lot of people love it. The reason being is that it does stress the cardiovascular system. It's a very strong vasodilator. This means that it will open the vessels up and they'll get very flushed or red feeling. So if people aren't used to that experience, it may shock them at first. They may think something more serious is going on, but it's truly just trying to give an exercise to your vessels. If they do not like the flushing, the redness, there are versions that will reduce this. There's time release versions, as well as there's one called hexanicotinate. That one is a no flush version. But again, I'm still up in the air whether I think that one does as good a job as just a regular niacin. So again, you want to use this sparingly. You don't want to do it excessively. But what this does is taken on every day, it's activating those blood vessels to start working again. Next would be statins. These are the drugs that the medical doctors are prescribing. So they've actually been clinically shown to lower cholesterol levels and a primary choice for most allopathic physicians. So here's the problem. There are many contraindications and side effects. So you have to warrant, is it worth reducing cholesterol in this moment versus the side effects or contraindications that could be happening? So again, if somebody has fatty liver disease or they've already got muscle damage, they may want to second guess or look at a different alternative to the statins because it's only going to further irritate the system. If they are already diabetic, the statins will affect blood glucose levels and possibly make them feel worse and actually need more medication to balance that out. So again, it's not necessarily an option that we would choose or suggest for somebody, but it is an option that people are doing today. They still take statins. There's actually a substance that I add to when you're taking statins. It makes it actually work better and has been clinically studied, and that is called BERGAMOT, BPF. This is a marketed and copyrighted supplement straight from Orthomolecular. They've done the research, they've done the studies, and it's actually kind of interesting because they did studies on statin drugs, they did studies off statin drugs, and both saw improvements of lowering cholesterol and actually balancing the LDL and HDL variants. So again, what happens is they will convert an LDL to an HDL, and this is a one-way conversion. It doesn't go back. So taking bergamot helps you build healthy HDLs and reduce the damaging effects of the LDLs. So it's a very good one to suggest. Next would be healthy fats. Omega-3 fatty acids, omega-6s, omega-9s, they're all beneficial. So again, you need these healthy fats to build healthy cells. So again, I would look for a well-rounded either omega-3 supplement. I know that Designs for Health has a omega veil, which is a liquid omega, and it does not taste like fish whatsoever. So again, it's a healthy option. I actually give it to my children because they're the only ones that will, they fight me on every other supplement, but they love that one because it tastes good to them. So again, this will help reduce inflammation. So that's why we add the omega-3 fatty acids. Next is CoQ10, coenzyme Q10 or ubiquinol. Ubiquinol is actually the activated version. So if you're looking at supplements, ubiquinol is probably the one that you're going to gravitate towards. The reason we need this is it's crucial for making energy in every single cell of the body. What most people don't realize is that once you hit age 30, the production of CoQ10 goes down drastically. So if you want to help fight off the damaging effects of stress, reduce aging, keep energy, CoQ10 is a very beneficial supplement to help support that. Again, if you have a client who is heart stressed, their cells need more energy because they're under stress, ubiquinol is a very beneficial option. Next, we're looking at education. So education is crucial. At this point, it's the only way that we're going to break these statistics. You've got to help spread the message. You've got to lead by example as well. We do not want to be part of those statistics. I don't. I know that my other grandfather, one of the most important males in my life, had 13 bypasses. I don't know about you, but I don't want 13 bypasses. I don't want anyone else to have 13 bypasses. Now, granted, he lived his life hard. He lived his life like he wanted to die when he was 50. Well, he lived into his late 60s, but again, his quality of life was just not there. He did not take care of himself. And again, that shows me that if I don't take care of myself, that's what I'm looking for down the road. And then I love the Albert Einstein quote, "Insanity is doing the same thing over and over, but expecting a different outcome." So here's the thing. We've been using this data for 80 years. We've been trying to build on it. We've been trying to get better with our heart care, our preventative medicine, but we just aren't hitting it. We need to change. We need to be more proactive and go after this before it becomes an issue. We don't need to be reactive in this instance because that's actually doing us more harm. Here is the interesting quote that I pulled from the Mayo Clinic. "The aim of medicine is to prevent disease and prolong life. The ideal of medicine is to eliminate the need of a physician." What does that tell you? And this guy still practiced. They didn't kick him out. They didn't scream. They didn't tar and feather him. This is what he was trying to convey. Was the whole point is that your body does the healing. We don't cure. We don't fix anything. Your body does the work. So the whole point is we need to give the body the nutrition. We need to give it the foundational support that it needs so that it can actually do the healing and keep you functioning and keep you happy and give you a good quality life. Here's my two little ones. Now, it's not the most up-to-date picture, but it's super cute, and I love these two guys. And this is my why. This is why I wanted to share this information. This is why I wanted you to know that heart health is very critical, and I want to support a world where they don't have to be at risk for having heart issues. Knowing my family history, which is now their family history, I wanted to make a safer place for them to live and not be at risk for having issues. But these two guys, man, I love them. So thank you for listening. I know that it was a lot of information and I kind of just shot right through it, but I wanted to be kind of curt, to the point, and just give you the really important information that's still going to benefit you later on. Of course, you need more study in this. This isn't anything that's going to be the end-all, be-all, but it takes time to master this information. I did not get this information in a single year. This has been over a lifetime of practice and utilizing this information and putting it into play. So again, if you need me, go ahead and reach out. You know, I answer emails. That's my cell phone right there. If you need me, give me a call. I answer questions. I help people out, but that's what I'm here for. I'm here to help. And I want people to not have the fear that everyone's putting in them. So reach out, definitely. So again, I'm going to give this back, and let me bring in Jeff.
We're back. That was awesome, Jason. Thank you for doing that.
Well, thank you.
The webinars are so funny because, you know, I'm sure everyone is so grateful, and I wish there was like almost a clap or an applause button that we could all let you know how grateful we are for your time in putting this together. It was awesome. We do have, FYI, we do have some questions that we've been kind of compiling throughout the the presentation. Let me hurry and just bring this up. That I'd like to kind of go through. So these are kind of probably chronologically as we receive them, but what lab is used to test for the LP PLA?
I use Quest Diagnostics, and they're all over the country, so you should be able to pull that through them. Berkeley Heart Labs, I believe, is also used with Quest Diagnostics, and both of those. I know that Ulta Labs, I believe they have the ability to use that test as well.
Okay, awesome. Very good. So besides ZYTO, what kind of other testing tools do you use in your office?
Actually, I use my hands quite a bit. Of course, being a chiropractor, you know, you've got to have those palpation skills ready to roll. Other than that, I will use some muscle testing. Again, it's a very useful tool. It's like checking a reflex. If you have an imbalance in your energy and it now causes your muscles to go weak or strong, that's a good indicating factor of that either the supplement is good for you or bad for you at that point. And it's a picture in time. Right now, that supplement may not be beneficial for you. Could be later, but again, right now it's not working. So muscle testing, palpation skills. I like to use my eyes and ears. I listen to presentation. I watch how they walk in. I use all of these visual cues to help identify what's going on with them and how I can address. Specifically the emotional aspect, you've got to listen to your clients. You have to let them tell their story and share that information. Now, that doesn't mean let them have all day to talk your ear off, but you also have to take in what they feel is important and then use that information to move forward. If you do not address something that they say or they feel is important, you're going to lose that client.
Awesome. Yeah, I think that's actually, that's really great feedback. I hope people hear that because it's really important to, that's one thing I think we struggle with in the Western medicine side of things is people that aren't always willing to listen to what their clients are trying to get them to understand. And so it's really important to do that. I appreciate that.
Yeah.
So let's see, we had another one. What is your opinion on checking magnesium levels such as the magnesium RBC and the role of magnesium in heart disease?
Magnesium is super critical. I would only test the red blood cell magnesium level. If you're testing the plasma level, you have no idea if it's actually getting to the cell. So again, I don't test just a blank plasma level for magnesium. I do test the red blood cell. Again, this was a short lecture, so I didn't go over everything with the heart, but yes, magnesium plays a crucial role in how the muscle can actually contract.
Awesome. Very good to know. So can you take this Bergamot BPF by itself?
Yeah. Yeah,
Okay.
They did the clinical studies where they took it with the statins, and then they did the clinical studies where they took it without. They had a slight increase of benefit with the medication, but it was still a benefit. So both still benefited the client.
Oh, that's awesome. And that was, I'm trying to remember, who was the one that did that study?
That was orthomolecular.
That's right. Okay. Very good. So does that same Bergamot assist to decrease LDLs even in the genetic condition for high LDLs? There is, in this question that was phrased, there was a super complex word that they use, hyper-beta lipoproteinemia.
Yeah.
I hope I said that correctly. I hope I wrote it down correctly, first of all.
Actually, I think you did it justice.
All right, okay.
Uh-huh. Yeah, you
So
did pretty well.
To decrease those LDLs even with that genetic condition?
I'm trying to think if the pathway is still open. I believe it is, but it's using the pathways in the body. So if the pathway is screwed up, that may not be as beneficial, but I would still see a benefit.
Okay, great. So we have, where are we at? We'll probably take a couple more. We're getting a lot of questions in, so we're trying to filter through a bunch of them. But what's the role that you see with gut health and probiotics when it comes to this?
Oh man, guys, they're hitting all the foundations. So again, when I say foundations, you've got to support digestive health. You have to support sleep, stress, the lymphatic system. All of these things need to be supported, and gut health is crucial as well. And we talk about inflammation. And again, that whole lecture that I just did was talking about the underlying inflammation. gut health plays a huge role in inflammation. If your gut is not functioning appropriately, your immune system is going to be amped up. Your immune system or your inflammation is going to be amped up as well. So yes, keeping the gut health and keeping the probiotics is vital to reducing inflammation.
That's great to know. Now we've had a couple questions about a bergamot essential oil.
Yes.
Is that the same? Are you going to see
not,
kind of similar results?
It's the same plant. I did not see the same results. I tested it out. I was like, yeah, you know, it's the same. It's bergamot. It should work. And I could not get to the same results that I wanted.
Okay, that's great information to share.
But it's the same plant. It's the same. It's probably just a difference in strength and how they process it.
Okay. Okay. There was a question about, does the bergamot BPF need a professional account?
I'm trying to think with orthomolecular. They may need a professional account.
Okay. Okay. And I think that, yeah, they do. We're being told. So yeah, that would.
Yeah, I think that is. So okay. Sorry that I recommended a professional account, but
hey, that's okay.
It shows benefit.
A lot of people here have those types of credentials as well. So
okay.
I'm getting a lot of people saying that they're virtually clapping for you in application. So that's a good sign.
Thank you much. Thank you.
Yeah, no, we really appreciate it. If we have additional questions, we're going to, towards it, I believe at the end of this, we want to open up the opportunity for people to give feedback for this, and then we'll direct questions either over to Dr. Jason Ameling or to ZYTO staff that can help answer those questions. And there needs to, the light keeps on going out. I apologize. We're having a light show over here. But yeah, I really appreciate your time. It was very interesting. This is a great way to kick off our wellness webinar series. This is actually a new template and format that we're going to follow on a monthly basis. So we have our next month webinar scheduled set, and I'm actually going to click down over here. So Trey Hatch, who is actually a TV chef and author, is our presenter that we'll be bringing in next month. She'll be talking about reframing your relationship with feelings, foods, and flavor. We've worked closely with her at ZYTO. She's a phenomenal person. We're really excited and privileged to bring her in and share her insights in a similar format like we've had today. That webinar will actually be happening on Wednesday, March 7th at 10 a.m. Mountain Standard Time. So it's actually an hour earlier than we had today. That being said, that will be our new standard time, is at 10 a.m. Time block moving forward for future webinars. We're super grateful for everyone participating with us today, whether it's live or in the recording that will be distributed. In the next few days, you'll actually get, as part of registering and attending this webinar, you'll have this recording available to you. And yeah, Dr. Ameling, thank you so much for being in attendance. Appreciate all that you've done in preparation for this. And we'll plan on seeing you guys at our next webinar here in a month.
Yep. Well, thank you for having me. I do appreciate it.
Yes. Thank you for your time. Have a good day, everyone, wherever you are around the world. And we'll chat with you next time.
All right. Thank you.
Yep. Bye-bye.
Bye.